Good afternoon, ladies and gentlemen. Um, it's nice to see that so many people are waiting for the end of the day lecture, and it is echocardiography tutorial. And the very name indicates that it will be a very basic one. And my part is more basic. So I will talk about know your echo machine. So all of you know that know thyself. That means thyself here is me and my machine as well as my patient. So there are so many machines in the market in the different hospitals. Which machine do you want to know? In fact, who should know about these machines? So in many of the countries, there are sonographers, echocardiography technicians, who mainly take care of this machine, imaging quality. But in our country, we do it ourselves. So we should know it ourselves. And why should we know it? Because we have to decide whether the patient is a normal one or a pathological one. If the patient is a pathological one, what is the cause? What is the severity of the lesion? What are the complications or associated lesions, and how should I treat this patient? And what are the parameters to need to treat this patient? To answer all these questions, you need to qualify and quantify your patient's heart with different parameters. And for each parameter, there are different settings in the machine, and you should know about it. So basic thing is you should know how to optimize the image and how can you measure a specific parameter, what are the subsets or setups for a specific parameter, and who is going to teach you. As a echocardiographer, you should have the basic knowledge of ultrasonography, different terminologies and different options in the ultrasonography. And definitely, you can take help of your application engineers. The application engineers know many things, how different parameters can be measured, how your machine can be measured. And most of the modern machines has got every opportunity to different parameters. Only thing that you have to ask your application manager, engineer, that let me show or give me the way how can I measure these parameters. So there are different machines. This one is the G machine. If you look at the machine, there are some basic parameters, fundamental parameters, like continuous wave, color, like 2D, and like layout, different things. For each parameter, there is a change in the basal part of this screen. It is also applicable in different machines. Like in 2D, you will get some different setups. You have to adjust these setups to get a better 2D image. For continuous wave, they will show a lot of setups and you have to adjust it so that you can measure these things exactly. So it is also available in other machines like Philips and things. One of the two important buttons in these machines, like in Philips machine, there is a eye scan machine button. In case of GE machine, there is a auto button. So they set up some settings in these two buttons. Whenever you start the imaging, you can press this auto button or eye scan button, and this will give you an image with a preset data or preset setup. But this may not be applicable for every patient. This may be applicable for a normal patient, for a lean and thin patient, but this may not be applicable for a obese patient or a patient with COPD or a patient with different lung diseases. So you have to know how to further tune this setup to get this one. First start with the probes. There are different probes in a machine, transthoracic probe, transesophageal probe. In case of transthoracic probe, there are probes with higher frequency and smaller footprint. There are probes with lower frequency and larger footprint. And we are habituated with this, that the higher frequency should be used in case of a pediatric patient or neonates or patients with thin chest wall, and lower frequency probes are used for the adult ones or obese the person. And the difference is that the higher frequency probes has got lower penetration, that is depth will be low, higher resolution, but poorer Doppler studies. So in many of the patients, if you use a higher frequency probe, the continuous wave and pulse wave Doppler may not be that much great. On that case, you can shift onto the lower frequency probe. And there are some set criteria for which type of frequency you can use for the adults, pediatrics, and neonates. There are some other knobs like octave or frequency. That knob will allow you to shift the frequency of the probe within a certain range of frequency, like this one. If you change the frequency, look at these two pictures. Definitely the right one is not that much great. The left panel is a better picture. This can be done by changing the frequency probe of the patient. Another important thing is the sector width. How much heart do you want to include within the your image? If the sector width is larger, definitely the frame rate will go down and the image quality will be lower. If the sector width is smaller, the image quality will be better because the frame rate will go high. And this is more applicable in case of tissue Doppler imaging. You know better that in case of tissue Doppler imaging, we need very high frequency frame rate, which is more than 70. On that case, you need a very small sector width, and that will give you a better tissue Doppler imaging. If you use a larger sector width, this tissue Doppler imaging spectrum will not be that much great. So another important thing is the depth in the image. Definitely, this is the same patient with two depths. If the depth is high, it will include more tissue beneath the or beyond the heart. So the heart shadow, the image of the heart will be of lower quality. If you increase the depth, lower the depth, on that case, it will not include the lower part of the tissue beyond the heart, and the image quality will be better. So you should know how much depth you will use in which patients. Gain is an important one. Gain, during the image recording, you can change the gain of the patient. Definitely, in this case, patient, the endocardial borders are not very well visualized, but in this case, it is better visualized. But problem is the surrounding tissue is also important. So when you are going to see the endocardial border or going to see the echocardiographic echogenicity of any structure or thickness of any structure, you have to get the proper gain of the patient. This can be changed by the gain probe or other mission, like this one. It is a transesophageal echocardiography. If you look in this picture, there are echogenicity in all the chambers. Look like the spontaneous echo contrast is in the whole heart. But if you lower the gain setting, the spontaneous echo contrast is only in the left atrium and its appendage. The other chambers are normal. So that is the important thing, how you set the gain. During the setting the gain, you have to make the blood pool echo black. That means if there is nothing in the within the chamber, that is the blood pool, it will be black. That is the setup for gain setting. And if you see that the one part of the image is of greater echogenicity, another part is of lower echogenicity, you can change the gain by this TGC. Another probe, I think every one of you have seen this thing. If you move this sheep towards the right, there will be increased echogenicity, more white, and if you do shift into the left side, it will be more black. And thus, you can adjust the gain of your patients. Another important thing in echocardiography is the frame rate. Frame rate means the better the frame rate, the higher will be the resolution. The higher will be the temporal resolution and spatial resolution. And this frame rate can be changed by different parameters. Like this, as I have shown the sector width. The greater will be sector width, lower will be the frame rate. Smaller the sector width, the higher will be frame rate. Depth, the higher will be the depth, lower will be the frame rate. That means lower will be the quality of the image. The lower the depth, higher will be the frame rate as well as the quality of the image. And definitely the machine can also change the frame rate of the image. With the same sector width and same depth, you can change the frame rate of the image by changing the knob in the machine. And these are the different images using different frame rates. Definitely, you can adjust the frame rate and can make a better image. This is another important thing, B mode colorization. Most of the time, we visualize the heart in the gray scale, but sometimes, or some laboratories or some operators try to image it in different colors, like this one. It depends on the habituation of the operator, and sometimes this B mode colorization can change the contrast of the different structures of the heart. You can change the focus point of the echo machine. Focus means they, up to certain extent, the ultrasound images or signals runs parallel, then it spreads. That is the focus point. This is the markers of focus point. The up to the focus point, the image will be of better quality. So in this image, the upper half of the image has got a higher quality, and when you reduce the or change the focus point, the more and more part of the heart will be in the better quality portion. So that you can change the important zoom view. We rarely or sometimes use this zoom view. Zoom view is used for two important things. Number one is for better visualization of the cardiac structures. It will make the cardiac structure more visible. Like in this case, the aortic valve is not that much great in this picture, but if you use the zoom view, it will be seen better. Number one. Number two, when you are going to measure the structures precisely, like the LVOT diameter, or mitral valve area, or any thickness, you need exactly to see the different borders. On that case, you can use this zoom view and have a better picture. This is another example of the zoom view. This is the mitral stenosis patient. If you want to see the subvalvular structure, you can zoom it and have a better quality of the mitral valve subvalvular structures. And there are some other knobs like compression knob, which can be used after taking the image. Post recording change of the image can be done by this low compression. This low compression can change the grayscale image from a poorer one to later one. There are some important things which we should know how to use, like the ECG. It is a mandatory thing to have a good ECG backup for echocardiographic reading. Respiratory cuffs, we should know how to use these respiratory cuffs, and this is showing the inspiratory phase and expiratory phase. We mainly use it to say to visualize the respiratory variation of different parameters like LVOT spectrum, like IVC diameter, like the mitral and tricuspid flow in case of cardiac tamponade. So we should use these respiratory cuffs also. In case of color Doppler echocardiography, three important things you should look for. One of them is ROI, the box which is showing. That means it should be as small as possible. You should focus only the structure on which you are looking for, because the smaller the box, the higher will be frame rate, better will be the quality of the image. Second thing, the color gain. The color gain should be changed. It will it will allow you to record the low velocity and high velocity colors in the same frame. So you should define what should be the color gain, and the color velocity scale also. The color velocity is important. Color velocity means if you want to record the low velocity blood flow, you have to reduce the color velocity flow, like in case of hepatic vein, like in case of pulmonary vein, or the flow across the interatrial septum. You have to set the velocity at the lower level, otherwise you will miss this flow. Again, in the case of high velocity, like mitral ligation, aortic stenosis, on that case, you can use the higher velocity, and that will give a better quality. Like in this picture, the velocity can change the aortic regurgitation gradient. It looks like a trivial one, but if you adjust the velocity, it looks like a better one, a mild aortic regurgitation. Similar things you can see in these color velocity scales. This is the velocity in case of hepatic vein, a poorer image, but if you adjust it, make it a lower velocity from 63 to 30, it will give you a better velocity. So three important things: ROI, color gain, and color velocity scale. In case of pulse wave and continuous wave Doppler, there are different things. One of them is filter setting. When you are going to time a spectrum, that is from beginning of a spectrum to another spectrum, you should bring this line up to the baseline. To bring it to the baseline, you should reduce the filter size, because if you increase the filter, it will not give you the end of this line towards the baseline. So this is filter setting. This should be used properly when you are going to time the spectrum. The baseline should be adjusted to prevent aliasing. You should use the velocity range properly, like this, the same velocity range. If you measure this velocity, it will be more perfect than this smaller velocity one. Similarly, you can change the gain of the patients, like this one. It looks like the velocity is higher, but if you use the exact gain, it will be lower velocity. This can be used in different cases. Like this is a case of aortic stenosis. If you change the gain, it will show that the mean gradient is 29, but in case of 24. So there is a change. Mild stenosis is becoming a moderate aortic stenosis. Similar thing in case of pulse wave Doppler. Like if you want to measure the aortic valve area in this case, if you cannot use the proper gain, in this case it is the aortic valve area is 1.04, in this case 0.86, same patient. So this setup is also important in many things. Sweeping speed is important. When you want to see the respiratory variation of any event, then you have to increase the sweeping speed, reduce the sweeping speed. But if you want to measure the spectrum, whatever it is, a peak gradient, mean gradient, VTI, timing, you have to give a sweep speed of 100 millimeter per second. There are different measurement parameters in your machines for a single parameter, like this one. If you can measure the LV function by means of Simpson method, you can use it by auto ejection fraction in many machines. I think this machine has got, GE machine has got this option. You can use it by 3D machine. So you should know what are the options you have got in your machine to measure the ejection fraction on. In some cases, you may be confused with the Simpson method. Then you have to go for auto ejection fraction, or you have to go for 3D ejection fraction. And similar things can be given in case of right ventricle also. Right ventricle, you can measure the TAPC, you can measure the fractional area change, or you can use this strain pattern or 3D echocardiography to measure the ejection fraction. So you have to know all the armamentariums, you have got all the weapons you have got in your machines that will help you to measure or give the exact result of your study. Like the left atrium, we can measure the left atrial volume by means area length method or disc method. But if you use the LA strain, this will give you the LA volume. At the same time, this will also tell you the function of the LA. So if you machine, I have seen many physicians use a very high quality machine, but they doesn't use these options. As a result, they cannot give the exact result or the better report for the patients. And ladies and gentlemen, the anatomy, physiology, and pathology are variable among the individuals. And sometimes in the same individuals in different times or different setups. So the image or the setup for the acquisition of the image will not be same in every individual. You have to know how to change the system, how to adjust these things, how to get the better image, how to measure the different parameters, how to quantify and quantify different pathologies and normal in your machines. Because this is the thing by which it will make you a better cardiologist with a better report or a cardiologist with a poorer report or false report. Thank you all. Thank you for patience.